Let's imagine a moment that many families and clinicians experience. Ventilation is withdrawn, the monitors go quiet, and the patient has died. In donation after circulatory death, DCD, clinicians do not begin organ recovery immediately. They wait. And in most Canadian and international protocols, that waiting period is exactly 5 minutes. So why 5? Why not 3? Why not 10? That timing is built around what can happen after someone appears to have no cardiac output, and specifically, the possibility that the heart restarts on its own after appearing to stop. So, what happens immediately after cardiac arrest? When life sustaining measures are withdrawn, the heart does not simply stop in a final clean moment. Even after visible pulselessness, the heart can briefly regain electrical rhythm, briefly generate pressure, and produce one or a few cardiac cycles. And importantly, this can occur without any external intervention. In a large multi-center study where vital signs were continuously monitored, these transient returns of activity were seen much more often on waveform review than bedside clinicians actually detected. Clinicians physically notice in about 1% of patients, but waveform review showed evidence of brief returns in about 14% of monitored patients. Most lasted only a single beat and resolved spontaneously. So the heart may flicker, but it never restarted in a way that returned consciousness, circulation, or survival. So, timing matters. These returns did not happen randomly. They followed a very predictable window. The vast majority occurred within 1 to 3 minutes after pulselessness. The longest observed was 4 minutes and 20 seconds, and none occurred beyond 5 minutes in monitored cases. This is crucial. Within that first 4-minute window, the heart may briefly restart, pressure may briefly return, but without sustained output. After 5 minutes, the likelihood of return falls less to 1%. So, what does the 5-minute rule guarantee? It guarantees permanence, not just absence. Declaring somebody dead requires that the loss of circulation is not just present in the moment but will not return. It must be irreversible. 5 minutes is scientifically supportable because 1. When cardiac activity returns, it is short, self-limited, and ends within that time frame. 2. Beyond that window, observed recurrence becomes extremely unlikely. And 3. Clinically meaningful recovery never occurred. So, no one gained consciousness, no one returned to life, and no one survived. The 5-minute wait ensures we are not capturing a temporary low-flow physiology, but a permanent cessation. Why does this matter for donation? Donation is ethically possible only when 1. The patient is truly dead, 2. The death determination is valid and defensible, and 3. Families feel confident in the process. This waiting period safeguards the dead donor rule, protects patient dignity, preserves public trust, prevents families from feeling rushed, and gives clinicians physiological certainty. Imagine being a family member watching the moment after their loved one dies. Seeing clinicians pause, not move immediately, communicates respect, certainty, and finality. Also consider the emotional landscape. Withdrawal of treatment is already a deeply emotional moment. A premature move to procurement could feel too abrupt, create doubt or fear, and undermine the meaningfulness of end-of-life ritual. 5 minutes can feel long in the moment, but medically, it is short enough to preserve organ viability and long enough to ensure permanent cessation. Now let's bring it back to our question. Why do we wait 5 minutes after circulatory arrest before beginning organ recovery? And is that delay enough to guarantee no autoresuscitation? What's the answer? We wait because when cardiac activity returns spontaneously, it does so only temporarily, without meaningful circulation, and always within approximately 4 minutes. But 5 minutes? The likelihood of any physiological restart is effectively negligible. This timing protects ethical boundaries, protects patient dignity, and ensures families feel confident that death has truly occurred. That is what guarantees that when organ recovery begins, it is happening only after death, permanent, irreversible, and witnessed with certainty. This is why we wait.